this. So really taking the step to have self-care, self-management of the health for older adults. So when I'm talking about different type of technology, it spans from different area. So for example, health monitoring, they could use the smartphone or the smartwatch to monitoring the tracking their health vitals or some of the patterns, and then they can also use mobile health apps to manage their health, manage their medication, to adherence with their medication if they have a health condition already, and then of course somehow they can also use the mobile health apps for exercising. Then when they go to physiologists, they will recommend some app that they can use for gym and exercise, and also for nutrition or hydration purpose, they can really tracking the meal and having the healthy eating habit and diet. So what motivated me to conduct this research, and also a few things to keep in mind why we want to focusing on digital health technology for older adults, is that more broadly we have a global aging population, but it really go down into the health system and the transformation. We really switching from a traditional healthcare model to a preventative health model. So there are a couple of policy initiatives, including the WHO globally, and in Australia we have a digital health blueprint, really trying to promote older adults using digital health technology for preventative health measures and purpose, and then they can get the potential benefit into self-managing their condition, and then also can improve their health and well-being. They can stay independence for longer, and having the reduce the hospitalization for the healthcare system. So the research gap really lie under this this research. What we really know about digital health technology engagement among older adults. What we know so much about is the adoption. We're always talking about adoption when it comes to technology, older adult. We have a couple of models that existing research often use would be the technology acceptance model, so such as TAMS, UTAT. So even some of the research really go down to a health context or senior context, but somehow they are still focusing on some very basic barriers, such as cost, digital literacy, so focusing on ease of use, you know all that for a acceptance model. So what happened is really after older adults adopt kind of technology that suit their health purpose or use, but they kind of like abandon that after a period of time. So what we really don't know or remain very unclear is the continuance. So having the health maintenance and using digital health technology as a tools to maintain the health for ongoing benefit, we really want to get into understanding what is factor behind will influence their continuance, what are the factors, what are the support they need for ongoing engagement through different stages, even from learning, curating, to a stage where they can get into a habit. So why continuance really matters in this research context is that it's really essential for them to keep using it for a longer help and well-being maintenance and benefit. We leverage this tool to enable them to leverage on maintenance and improvement. So my broader and overall research question is, what are the positive and negative influence or factors that will influence their continued engagement older adult with digital health technology for preventative health? So far, I have conducted the phase 1 of my PhD study. So in overall research design, there are 3 stages. I follow the sequential mixed method. So I started by interviewing expert, which I have completed, and this presentation is focusing on presenting the finding for the first phase. And then after that, I will also go on to talk to older adult, interviewing them, and then followed by a survey. So there's some rationale why I want to conduct an expert interview before really get into end user. And then I found that it's not often in the research in this area, they have understanding from an expert perspective. So here some of the values would be important to get from an expert perspective is that the expert, they have many experience. They can synthesize different cases and patients they have been dealing with, and so they have a diverse older adult group. They understand their how are they using, what are the journey, so they can also would understanding some of the system level may not be only be observed from the end user or the consumer, so that they can seeing some of the factors that from a system level pressing into the consumer level. So it's also recognizing and some of the patterns to see if some of the implementation, what works and what doesn't work, what are the failure behind the implementation, and understanding the factors. All right, so I have done my expert interview. I really had the pleasure to interview all these experts come from different diverse area who work with an intersection with digital health technology and older adult. So I've used purposive sampling. I have interviewed at some of the expert, they must have at least 2 years experience working with older adult. At the same time, it must be related to digital health technology. So I have done some of the interview in Australia, including rural area, and two of them are from New Zealand. Some of it online, some of the face-to-face. And then they experience really span from 4 years to 40 years, so they have really extensive experience working in the field. And then you can see that some of them are from research or academic backgrounds, but somehow they still have a different dual role they're working on. Some of them are registered nurse, some of them are health informatician, and then some of the allied health professional. At the same time, they are also working on geriatrician. I have community and education provider who working in the library, assisting older adults to use technology. Some of them provide educational and community support, and I also got policy makers. So it really gives me the triangulation and kind of the findings really based on the experience they have that cross different sectors. So this research had been done last year, which I have analyzed now and completed the findings, 16 interview. So the analytical approach I use is a hybrid approach. First, I have started by using an inductive approach by just open coding and then finding the facilitator and constraint. And then slowly emerging into the thematic analysis, I found that some of the themes really relate to the capability, environment, or some of the motivation from choices to habitual use. So that's why I come down to using this COMB model as a deductive approach. Work as a lens for my research, understanding the capability, opportunity, and motivation that can direct the consumer into digital health engagement, so the behavior. So I've done the mapping. You see that in my findings, I will be structured a way that unpacking the COMB model. So that's how it's interesting. All right, so I will first start by the first component, physical capability. So the key finding I found out from this group of finding is the physical capability could be dynamic, it can be evolving, at the same time could be diminishing. So it's not static. So some of the experts have come and tell me that the adaptive design could be evolving or diminishing because of the health condition. Some of the specific health conditions, such as diabetes, could be affecting the touch screen. So sometimes that is not even can be controlled by the consumer itself. But as they learn more, they can also build on the capability. Sometimes they can change the capability, sometimes couldn't be because of the health condition. But it's really come down to the minor details. So even the physical comfort, just like a smartwatch using a rubber belt that could affect how people delicate skin, that will affect their long-term use. So it does matter into to having some design that's accommodating for people who have ability that is very diverse, having a variation. We know that older adult group is very nuanced. We have the different segmentation. They should cater for them as they age. So come down to psychological capability. One interesting finding I found that from this expert interview would be the cognitive challenge, quite situational. So it's not really the case that apply to every single individual older adult. So sometimes just like this geriatrician have mentioned, sometimes people have cognitive impairment. Doesn't mean that they can't learn new things. They can still learn some of the new things or new technology, but some people can't. It really depends on the type of technology. So that's why they face the challenge is not only coming from the health perspective, but also from the technology perspective. Supportive learning, scaffolded learning environment, and support will really help them to overcome this limitation. And come down to physical opportunity. So that's one interesting finding is the tension between the technology advancement, but at the same time, there are still some of the rooted systematical barriers that older adults facing. Not only older adults, as a clinician or as an expert as well, they also face some of the issue. So one of the biggest issue would be the interoperability. So what it means that is that the different apps and different systems, sometimes it work to the clinician, but at the same time, the older adult, they have to adapt to different apps. So for example, they go to some physiology kind of exercise program. Sometimes they have to learn one app. But if somehow the clinician, they have promoting another app, then they again have to learn another thing. So it's constant relearning, constant changing that was inhibiting them to continue using for the opportunity. So another opportunity is the social opportunity. So trust is a very critical factors which shape the continuous engagement. So older adults, they have the opportunity to reach out to network that they have, including the health professional they are treating them, also the family, their peers. But what really matters is the trust that they give to them. So if it's slightly different when you're looking into the trust factor into the peers or family, because older adults seems to listen to what the healthcare providers say. So what the GP is saying to them, what is the, some of the physiology is saying to them. So how come that they're going to recommend something to them? It matters. But however, this policymaker have stated that some of the clinicians still have some underlying aging assumption imposed to the older adult. So if they are already kind of like getting hindrance at this step, they might not even try to adopting and continue on using it. So this is a thing that will really hamper them to have the pressure, having what is affecting the independence, because they have to reach out to people at the same time, getting that limitation from different group of people that around them who can support them. So motivation, I would say that is the most interesting finding, and then of course is most of the code and themes are coming from this component. It's really as the major influencer to the behavior for older adult. So for motivation, this is come from not only for achieving the health goal or some of the decision. Somehow it's really they want to achieve the goal is for the independence. So when at the same time when they want to achieve independence, they don't want to rely on somebody to learn for a longer period of time. So it creates a dependent on the support network who's going to they are going to learn from. So they really looking at to the benefit, but at the same time, as I mentioned, the opportunity for trust, but it's also mentioned in here as a motivation is a trust damage. Really would demotivate them if they have the negative experience as they learn. So when they go to attend the library, they're going to attend some of the session to learn about this technology for the health. If they get a negative experience, it doesn't last anymore. It can become a barrier. All right, so the last component, motivation, automatic motivation, plays the biggest role into older adult engagement, ongoing engagement for digital health technology. Is really matter is the habit and emotion. And interestingly, when I found from the expert interview for the expert, many of them, they work in the mental health unit, so they're able to provide more insights into the mental factors and what is emotion and what are the psychological factors that demotivating older adult. So what it comes to most interesting finding in here is the social anxiety. Usually we will hear about technology anxiety, about learning the technology and having the anxiety, but more than that is the social anxiety. So older adult really really care how do they use the technology in front of somebody or including their loved one, just like this educator saying that some people just not that they don't want to keep using it, it's the fear of looking like a fool, right? So some people find that they don't want to look stupid in front of some of the grandchildren. They want to use it, so even they don't want to look like a fool in front of the educator, so that they could be they look like they are learning something, right? And then they showing that they know how to use it, but behind they may not be really learning how to use it, right? All right, so I just have a summary of what are the continuance factor across this COMPI model. But you can see here there are many factors that can act as the factors for continuous engagement for older adults using digital health technology. But as a summary here, some of the key finding is to tell us as a social marketing practitioner is really how to support different group of older adults. So to look at their different ability and of course adaptation to the changes. And then, of course, also get down into some of the systematic or infrastructure change that need to tailor for different group of older adults for their ongoing engagement. And then for motivation is really to guide and support older adults transitioning from some of the conscious decision to behavior, and even some support can then deal with their emotional responses. So overall here, the key is all about tailor some of the segmentation and find out what works for which group of older adult, what capability they have, and they can leverage the opportunity to motivate them to keep using the tool to improve their health and well-being. So this, my research for this presentation will end here. I'm just really excited for the next phase of my study, which I will talk with the older adult. So hopefully I will unpack and I'll find out more as I go through the next stage of my research and share with you all in the future. Thank you very much.